So I'm a type 1 diabetic. So I had a high-risk pregnancy. I had all the common pregnancy, symptoms that any moms could have. And about 33 weeks, my water broke. I didn't know that it was my water breaking. So we're Googling this, what it looks like, everything. And Burke's like, let's just run up to the hospital. I said, am I having the baby? She said, yes. So the amazing part was I got to meet every nurse, every doctor, the NICU team as a whole. They all came in ahead of time, introduced themselves, and prepped me for what their process is once the baby comes. Once he was born, the NICU team took him and they kept his bed a little closer to me so I can kind of see and make sure, and then they worked on him because he was not breathing.
We learned that they would have to breathe for him. That was scary, but the amount of people and the level of calmness among the doctors, the nurses, everybody was incredible. It was crucial for us because we had no idea what was going on. It was really hard to see him in the incubator.
So they were very relaxed. They made me feel like he was okay.
So initially, we're just trying to keep them stable and keep them comfortable. Every child is different, so you can pretty much guarantee they're going to have some respiratory problems like the Schultz family had. For example, he was on the ventilator for about almost 2 days, and then we switched him over to bubble CPAP, which is a less invasive mechanism of keeping their respiratory effort in an acceptable range.
Visiting Hudson in the NICU was very special, very memorable. My first thought was, I didn't look at the tubes, I didn't look at, what incubator he was in, I didn't look at anything, I just looked at him. I was like, he's mine. The nurses were very helpful with telling me kind of what his progression was. Why is this tube on him? What does that tube do for him? Just explaining everything that they're doing to him every day.
They would explain stuff because they would ask questions because I wanted to know exactly what was going on. But no, they were very patient and they maintained the level of calmness that we really needed, for sure.
So we always try to keep those open lines of communication open so everyone knows what's going on at the time, because it can be very scary, especially for families like the Schultz family who it's their first child. So not only are they experiencing the thrills and the anxiety of just being a first-time parent, but also the uncertainty of their baby and the sickness and respiratory distress.
And then they said, come up whenever. Here's our direct phone line. You call whenever you would like. So the hard part was finding the time, once you get home, balancing, my work schedule, my home life, driving back and forth. It was difficult to find the time.
Well, that was really stressful. Especially for Avery, 'cause she was coming up here literally every feeding. And I would come up here during lunch and after work.
I am so thankful for those memories, for that experience, and especially grateful for the doctors and nurses that kept him alive. Every day since he was born, I kept thinking, I need to show my appreciation. I want to give back. I was just thinking, how can I do that? But I was like, I really want to help the families, because yes, your baby is in the NICU, but families really are impacted too.
So when Hudson had his first birthday party, the Schultz family decided to request that the attendees bring gift cards that could be used at gas stations rather than presents for their family or for Hudson. This piece of plastic can be the lifeline of really getting the mom to the facility, having the resources to bring their part of the care plan to the bedside.
I'm grateful for my son. He has changed my life in a million positive ways, a million amazing ways. So I'm grateful for him. I'm grateful for actually the experience of going through the NICU. They taught me how to be a mom.
I am grateful for the entire delivery team, the NICU, every single person that interacted with us or Hudson, the doctor delivering, and then every nurse in the NICU. They were just perfect for what we needed.
Honestly, I'm thankful for being a part of a specialty that is so unique, and you see life-changing events happen on a daily basis.
It impacts families more than you know until you leave. When you leave, you'll look back and be like, wow, you know, they really took care of us. They took care of the family. They took care of my baby, and now I can bring him home, or her, and live a normal life.